we're going to talk about what to bring to the hospital. The first thing that we're going to talk about is what will you need over in labor and delivery? The bag that you'll take with you right when you get to the hospital. And then there's going to be another bag and a car seat that you'll bring with you when you go into the postpartum unit. But over to the first bag, the number one thing I recommend people bring is snacks. And the reason I recommend snacks is because it is often that they don't have snacks that you would like. There are also situations where you need to have snacks for your support person. And there's a lot of debate about eating in labor. There are some providers who are old school who still practice as soon as you're getting induced or are in labor that you can't have any food. You can only have ice chips or clear liquids. And there are others that are like, no, you eat until you get an epidural and then you only have clear liquids. And then there are others that are like, you eat anytime, it doesn't matter to me. And so having snacks so that you can decide what works best for you. I will link an article from Evidence-Based Birth about eating in labor, and you can refer to that, maybe print it out and take it with you to the hospital and use that information to decide where you want to take the risk. So let's just talk about that risk for a second. One of the risks about eating in labor is that you might have aspiration pneumonia. Now, how does aspiration pneumonia occur with a pregnant woman? It only occurs when you have to have an emergency C-section and you have to be put under general anesthesia. Now, I have to tell you, almost all emergency C-sections are not done under general anesthesia. They either have a spinal or an epidural, okay? But say, for instance, you're in that small group that actually does get general anesthesia. There's a small percentage of that group that can actually vomit during intubation or extubation. And if they vomit, there's a small percentage of those that could inhale that vomit. And if you inhale that vomit, you could potentially get aspiration pneumonia from that situation. So do you see how the risk gets smaller and smaller and smaller and smaller? And so that is the reasoning a lot of providers won't let you eat. So there are also studies out there that talk about the risk of not eating during labor, and that potentially causing your labor to stall out and potentially needing a C-section because your body's not doing what it needs to do because it doesn't have the calories and the energy to do what it needs to do. And so snacks is the number one thing you want to put in your bag. The second thing, bring a pillow. The pillows that we have at the hospital are plastic covered. They're very uncomfortable and they don't stay where you put them when you're trying to get comfortable if you're trying to actually have a nap. So I recommend you bring a pillow or two. Bring a pillowcase that's not going to get totally ruined if it gets blood on it. But usually we'll take your personal pillows away from the bed when it's time for delivery. Okay, so a pillow for you and your support person. I highly recommend a throw as well. The blankets and sheets are very scratchy. They're uncomfortable. And having an environment where you feel safe and comfortable is very nice because then it helps with all the flood of hormones, right? Because you feel safe and comfortable and loved with your support people. All those hormones can totally just release like they're supposed to. When you feel like you're in a cold, sterile environment, it can impact your hormone release. It can actually cause you to stress more. It can actually release catecholamines that can actually slow down and stall your labor. So we want you to be as comfortable as you can. Now, on that vein, a lot of people like to bring their own labor and delivery gowns. Now, there are several out on the market now that work with all the tubes and wires and stuff that we do in labor and delivery. So if that's something within your budget, I highly encourage you to do that. If not, some people will wear a bra and panties that they don't mind getting cut off. Not all of them will have to be cut off, but like that you don't mind getting cut off if you need it to be cut off. So it's totally up to you what you decide to bring. But again, the gowns are scratchy as well. The next thing I recommend that you bring on your list are things like chapstick is a good one, hand cream that you like because you'll start to get dry and everything being in the hospital with the air system there. I recommend that you bring slippers that can't be stained with blood or flip-flops. We do give you non-slip socks in the hospital, but they're kind of scratchy too. And a lot of people don't like their feet covered in the labor process because your hormones are going all over the place. So one minute you're freezing and the next minute you're hot. And so they don't like, get these socks off me. I can't stand them. So some flip-flops or slippers you can slip on really quick if you have to get up and go to the bathroom is a fabulous idea. Next, I would encourage you to possibly bring some essential oils, lemon, rosemary, chamomile, lavender. Those are the things that people like the most, and peppermint. Peppermint is a huge one because of just nausea and vomiting. The peppermint smell seems to help that. But the peppermint also helps in postpartum when you have to start urinating again if you're having any issues for that. Another thing I recommend that you bring to labor and delivery is a comb. And I know this seems like a very simple tool, but it is very useful. Remember when we were talking about pain? One of the things about pain is that if you cause pain in another area, it actually decreases your brain processing the original pain. Remember when you were a kid and you slammed your finger in the door or something and your parent was like, well, come on over here and I'll stomp on your foot and you'll forget all about your finger. There's actually science behind that works. Not that that would be okay, but I just remember them saying that. So anyway, you take the comb and you hold it like this in your hand. And so during your contraction, you're pushing like this and you're breathing. And that actually helps distract your body, distract your brain from feeling and processing all the pain from the contractions. So it's a very inexpensive way to cope with labor pain. Another thing I love is those little knobby massagers. I do have some of these things in my Amazon affiliate link in the pregnancy section. So you could check out some of the things I have there to see if it's interesting to you. But those little knobby massagers are great, especially because the support person's going to likely be doing some massage and heavy pressure, and their hands and fingers can get a bit exhausted. So a little knobby massager is great, or using your elbow is awesome as well. I also recommend for labor that you bring things like cards, games. Don't forget your chargers for your phones or tablets or whatever. But if you bring games and things like to watch, maybe you could download something or even stream if your hospital has good internet, but don't count on that. Not all hospitals have really good internet. So streaming may not be an option. If you download a Netflix or Amazon video or something, just in case. These are really important, especially for inductions, because inductions, remember, they can last for days. And so you want to have a few things to do just in case. Not everybody gets induced, but there is a large percent of people that do get induced at this point in the game, here in the United States anyway. Hair ties are also a great idea because it's very common for the hair to get in the way and start annoying you. And even if you have short hair, having a hair tie to pull up some of the top stuff here during the labor process can be very beneficial. The foods that I recommend that you take are things like nuts, cheese sticks, gummy bears or gummy worms, that kind of type of something that's chewy but not too dense. And a lot of people can do that even if they're having clear liquids. The gummy bears, I know one hospital I worked at, when people were on clear liquids after their epidural, they were able to order gummy bears. And there are like some Ensure ones that are actually clear liquid now as well. So that's really great to have on hand if that's something that you feel like you'd like to take with you. You want to make sure that you have snacks for your support person as well. And then if your support person is somebody who deals with pain or headaches or anything like that, make sure they bring like some Tylenol or ibuprofen, because in the hospital, we cannot give any to them. So that's really important. And then, of course, pillows for them as well. Refillable water bottles are great as well. Now, as far as postpartum goes, once you move over to the postpartum unit, your support person can run out to the car and grab your postpartum bag and the baby's car seat. Your postpartum bag should have things like a robe if you're going to be getting up and walking around, which is highly recommended. You can bring your own gown as well. I usually don't recommend that you change into your own gown until you're about 6 hours after delivery, just because it might get a little messy. If you don't mind taking it home and washing the blood out of it, that's fine. Just wear your own. But just know sometimes that first 6 hours can get a little messy because we'll have gushes when we get you up to pee the first few times. The outfit that you'll need for your ride home from the hospital will likely be the outfit you wore into the hospital, unless your water broke. So if your water broke, you definitely will need another one. And so you want to make sure it's still a pregnancy outfit, because when you leave the hospital, you still actually look a bit pregnant. Most women look like they're still about 5 months pregnant or so when they leave the hospital. And so you don't want to be feeling like you're trying to tighten into something, and you want to feel comfortable on your ride home from the hospital. Having some socks for the newborn is important. I know it sounds weird, but you need them for their hands. There are little mitts that you could get so they don't scratch their hands, but socks work really better. And we don't necessarily want to be putting outfits on them that have the little sleeves, because we want you to be doing lots of skin to skin. So if you get the little socks, then they won't be able to scratch their face so much. You won't need to be putting your baby in clothes at all during the hospital stay, unless you want to take a picture or when it's time to get ready to go home. Just because we want you to be doing so much skin to skin, it's too much work to keep undressing and dressing up a baby. It's too much work. So you'll be unwrapping, changing diaper, and putting that baby straight skin to skin with mom or dad anyway. So clothes for the stay are not necessary. So other things for baby, car seat. You want to make sure the car seat is a seat that will fit your baby pound wise. There are a lot of infant carriers that won't accommodate a baby that's less than 5 pounds. So really be mindful that it fits their weight, that it's not expired, and that was never in a car accident. Also, you want to make sure that you have the straps at or below their shoulder level when you are putting them in their outfit, and know that you can't have a puffy outfit on them in the car. So you'll have to have an outfit on them, and then you'll have to cover them up with a blanket to keep them warm, because puffy coats and outfits can actually make the car seat not work appropriately. So no babies, toddlers, children can be in big old puffy coats while they're in their car seats. One of the good ways to know if it's too puffy is to put the coat or jacket on the baby, put them in the car seat. Honestly, it's just really thin ones and thin fleece ones that are acceptable. But if you put that outfit and jacket on the baby, put them in the car seat, tighten it up the way it needs to be. Remember, the chest clip needs to be at the armpit level. And the straps, you shouldn't be able to pinch them like this. If it passes the pinch test, it's nice and snug. And the leg area, needs to be snug as well. Then take the baby out without adjusting the straps. Take the baby out, take the jacket off, and put the baby back in, and see if where those straps are acceptable and the baby still passes the pinch test. If they still pass the pinch test without you adjusting it again, then you know that it's a safe outfit, okay? And having a couple blankets that you could tuck over baby when they're secure in that car seat so they stay nice and toasty, especially if you're up north or somewhere where it's really cold this time of year, that's really important. As far as mom goes, we want to just make sure that she's getting things like adult diapers are great to bring with you, just because shifting around in the bed, sometimes the panties with pads that we give you, they shift too and can make a big mess. So there are a lot of moms who choose to bring adult diapers. They're like, no, this is way easier for me. You'll want to make sure that you consider bringing earplugs if you have a hard time, if you sleep really light. Earplugs and eye covers are a great idea. Some people bring room fresheners just because the hospital smells like it does. But if you have essential oils from your stay in the other room, then you could just use them in this room as well. And, having your slippers, your robe. You'll want to have toiletries because our stuff is kind of harsh. So your own shampoo, conditioner, face wash, whatnot. And you can never have too many snacks. Now, there are some people who come in with just a little bag, like a grocery bag, for crying out loud. And that's fine. And then there's people that come in with like a whole luggage set. And it doesn't really matter to us what you bring. We want you to be comfortable during your stay. And so if you are the type of person that likes to bring this stuff just in case, and you'd rather have too much and not need it, then do that. It's okay. We're not judging you. Just ask your nurses when you should bring what in. And if you have a labor bag and you have a postpartum bag, then that's fine. And each person doesn't need to have separate bags. You can have everybody's stuff in the mom bag and everybody's stuff in the postpartum bag, okay?